when you hear the word cancer, you almost always hear the word death at the same time.
Yeah.
And not all cancers are like that, or not all stages. There's actually, it's probably less. It's not a one-to-one association, So, but still, that when a patient presents with cancer, he or she is thinking about death, and so that's an incredibly stressful moment. And when you're in that incredible stressful moment, and the doctor is able to guide them, okay,
Yeah.
in both in terms of helping them with their medical problems, but in sort of relieving their anxieties, either sometimes towards death, because it is sometimes a deadly disease.
What's good, YouTube? Today we'll be talking about who oncologists are and what they do. We are joined with Dr. Imam, who is an oncologist in Orlando, Florida, and he'll be talking about what his journey looked like and how he became an oncologist. It's going to be exciting, so stay tuned. Welcome, Dr. Imam. It is great to have you here on my YouTube channel. How are you today?
I'm doing pretty good. I'm pretty good.
Okay, so let's get right into it. Can you give us a brief introduction about yourself?
Yeah, my name is Hassan Imam. I'm an oncologist in Orlando, Florida. Um, Now I've been in practice for 7 years, and uh, and I have 4 kids. I'm married, 4 kids, alhamdulillah. And that's me. I think that sums up me in the shortest version.
Mhm. Okay, so you're an oncologist. Can you briefly explain what that is and what do you do?
Yeah. So uh, we actually have medicine. There's many different specialties that are present, and so uh, there are big specialties like internal medicine and surgery. So medical oncology is a subset of internal medicine, and internal medicine is really the study of medicines and their and their the diseases and how to treat them with just medicines alone without necessarily surgery. So as part of a specialization of internal medicine, there is medical oncology, and that is really focused on uh, the art of treating patients with cancer.
Okay. So, how about let's start from the beginning. How did you start? How did you like think of like I want to become an oncologist? And how did that passion grow?
Yeah, so I think probably well, one interesting story is that I was at a fifth grade graduation for my oldest daughter's fifth grade graduation, and I was sitting there and I was listening to every kid wanted to give, or so no the teacher called up every kid and gave them an award or whatever, and then said what this kid wanted to be. Okay. And so we got a lot of baseball players, a lot of some engineers, quite a fit. And but I think doctors was somewhere down there, I think fourth or fifth in the number of people then, but no one actually wanted to be an oncologist except for one kid in Asma's class. Now my own daughter did not want to be a doctor. She said a teacher or a lawyer. But the my point is that most people, when you ask them when they become an oncologist, like when did they want to become an oncologist, it probably, the story doesn't start there. The story starts with, hey, when did you want to become a doctor? Right. And I think that's so. And I think that, so the answer to that question is probably, I would say fairly early on, maybe right around you know maybe even elementary, middle, or high school. I think sometimes that, like, I'm not really thinking about as much as what I want to be, as much as, hey, trying to get from grade to grade and max out the grades or whatever, sort of being in the moment. But if someone were to ask me probably in middle school or in high school, hey, what do you want to be, I'd say, yeah, I think I'd want to be a doctor. So that, I think, in part, so along the way, why you wanted to be a doctor, I'll get into a second. But then I think after I got into medical school, and I was in my uh, second to third year of medical school. Going from second to third grade, I was actually in a right. Our medical school is associated with a great cancer center called Moffitt Cancer Center, and I was there in the summer for some not a rotation, but like some kind of volunteer kind of program. And then I saw like what medical oncologists were doing there, and I think if you go back and look, if you can figure out that you want to do medicine, then like medical oncologists probably have in one of the deepest connections to their patients, um, because they will, patients will come to them in a time of great need, because when you hear the word cancer, you almost always hear the word death at the same time.
Yeah.
And not all cancers are like that, or not all stages. There's actually, it's probably less. It's not a one-to-one association, So, but still, that when a patient presents with cancer, he or she is thinking about death, and so that's an incredibly stressful moment. And when you're in that incredible stressful moment, and the doctor is able to guide them, okay, in both in terms of helping them with their medical problems, but in sort of relieving their anxieties, either sometimes towards death, because it is sometimes a deadly disease, and other times when it's not death, it can be a very profound kind of experience to go through, as both as a physician and a doctor. And some people will describe it as being in a cave that are going into it, like trying to get out of a tunneling out of a cave and towards like a light. And when you get to that light, so you share that experience for the rest of your life. And I don't know, our families have not really gotten like that much experience regarding cancer, or actually we might have some, but I think but families, when they've been with an oncologist that truly loves them and cares for them, they are very much in love with their oncologist, and will think about them at various times throughout their whole lives, like days during, whether it's Christmas or July 4th, you'll get text messages. So the relationship extends lifelong for these patients with their physicians. And if you look at medicine, I would be hard pressed to find another kind of in-depth relationship like this. And if you ever sit with me in my clinic, I think you'll find that people will, because you've been through this crazy time together, from the darkness to the light, they will share things with you that, outside those four walls, that they don't have the things to share. And you're not doing it as a mental health counselor, for example, where you're walking through that. You're just, hey, look, friend, I'm going through this. I went through this before. Hey, there's something else that come up, or good or bad. And that was incredible to see at Moffitt when I was there. And so I decided right then and there that, no other field was for me. This is it. Medical oncology would be the right way to go.
Yeah. Well, yeah, that's very interesting. So what really drew you to oncology was the relationship between like patient and the doctor, and how like intense that was. So that leads me to my next question. Was there like a very like memorable experience you had that you would like to share?
So that one's a hard question, because I don't it's hard to pinpoint as you get older one particular moment in your life where you felt, as you're working in your career, to you know that stood out for you. I think a lot of us doc physicians will say that sometimes the moment where you feel like accomplish something is the moment that you learn that you're accepted for medical school. I do remember pre that to be a very incredible stressful time, because you don't know, you have very little idea of how you're going to look 10, 20 years from now, because the path is divergent quite a bit. If you get into med school, life looks one way, and if you don't, life looks another. So I think that would be, that's a moment, like knowing that I think it was the University of South Florida that actually accepted me for medical school, and other schools later accepted me. But I think that moment I was so relieved, and felt sort of a kind of gratitude towards the University of South Florida. It's actually one of the reasons why I accept, because you accepted me first, and you removed this burden from me. I was sort of obligated to go there, but it turned out to be a great school as well, not just because of that obligation. So that might be one moment. I think there other moments, like I think you know, I'll tell you that you know, when I was in medical school, when I did when I did my cardiothoracic surgery rotation, and I remember them opening up the chest, and you get to see inside. Now, I think that, along with the moment that I had with in the anatomy lab when you were opening up a corpse's chest, but those were, I mean, to see that is an incredible moment in your life. And then the other moment where I think you know, I was, once I learned that I wanted to be a medical oncologist, I actually started to have a very relaxed attitude towards all the other specialties. So I'd be in there. So my medical school experience is very different from many, because I would do only the things that I enjoyed in my third and fourth year. Like, so OBGYN was one where I wasn't really interested in, but boy, I wanted to see one baby be born. And the idea of a woman giving birth to a baby, and as you held the baby come out, that, like, you have no choice but to look at this miracle and remember the one that created it. You think you're so blown away by the fact that a baby is born. So that those two moments, I remember thinking to myself, wow, I feel like I no I recognize Allah, or I recognize him. I see his signs, and so it was a particular moving moment, these two things. And it may be because I think it's very unique to a physician to do, like, or obviously you could be a PA sitting in the thoracic surgeon, but still in medical school, only few people get to see these two kinds of experiences: a baby being born and you hold the baby as it comes out, plus cracking open someone's chest and looking into their heart. That those two things, I think, were pretty profound in my in my career. Outside of that, I think uh, there are many stories in oncology, and
Yeah.
I think I don't want to,
Yeah.
I don't
Okay.
want to go into too much,
Yeah.
with that we could explore that a little bit later. But I think those stories weren't as meaningful because they become like, I see them all the time.
Yeah. Okay. Okay, so how about let's jump into like a deeper level of like what is oncology, and like in a general week or a month, like what do you do,
Yeah,
or a day as well. How
yeah,
does your day look like?
yeah. So um I live about 25 minutes without traffic from my work. With traffic, it turns out to be like sometimes about an hour. But so my goal is to leave the house every morning by at least 6 a.m. If I can get there earlier, it's even better. But 6 a.m. So that would mean on a normal work day, I'm at the office about 6:30, because there's traffic between, at that time. So 6:30 to 7, I would be either reviewing the prior day's patients or preparing for that day's patients. And then usually at 7 o'clock, there's a tumor board. A tumor board is where there's a discussion of 9 or 10 cases that are difficult, and you need multidisciplinary help in terms of a surgeon, a radiation oncologist, a medical oncologist, a GI physician, a pulmonologist. All those specialties will be there, and you discuss our case. So each organ or each system has its own tumor board. So I'm a general oncologist, although I do have a degree of subspecialization. But a general oncologist probably then should have to go to all of the tumor boards then to sort of listen and talk about his patients. So 7 o'clock to 8 o'clock would be my tumor board, and then from 8 to 8:30 is more preparation for the patients that are coming in, and then from 8:30 to 5 o'clock, I have to see patients that are coming to me in my clinic, and the average number of patients is about 30 to 40 patients. Now I do get a spot for like a lunchtime, maybe that is the last patient will leave the door around 12:30, 12:45, and the first patient will come in like somewhere around 1:15 to 1:30. So oftentimes I'll go to the hospital right then and there to round on a patient. Like one of my own clinic patients have gotten sick, and now they're in the hospital and they want to see their medical oncologist because they have, they don't really trust sometimes the doctors that are in there because they want to see the guy that they've been seeing. So I'll go in the hospital, then come back. And then so I'll go to the hospital during lunchtime, then come back. But now if I haven't been able to see the hospital patient during during lunchtime, I'll try to go see them after 5, like 5:30 around there. So that means, so then I'll go to that hospital and then come back. And now maybe it's 6:30 or 7, depending on how many hospital patients there are. And then I like to say that my real work starts, where I have to go and review the day's patients and complete follow up their notes, their labs, and all those things that are going on. So optimally my day should end somewhere between 7 to 8:30, depending on the amount of work that's going. But then, so Monday through Thursday, it's heavy. I mean, you're getting to work at around 6:30 to 7, and you're leaving work around 7:30 to 8 there. Now, Friday is actually an off day for me. So off day, but the problem is that the off day is still I have to go see the hospital patients. There's usually about 3 or 4 at least hospital patients that are sick that I need to round on. So I'll go to the hospital, I'll round on them, and that'll take me about 2 hours. But then outside of Jummah, right? Like outside of going to Jummah for an hour or two, Friday, the entire day, I'm actually doing the same thing that I was doing towards the end of the day on Monday through Thursday, writing those notes, researching different topics that have come up. In oncology, it's a moving field. So, there's a conference almost once every 3 months that does lots of tweaks and adjustments to the treatments that you're giving. There's lots of new treatments that are coming on. So whenever you see a patient that has a clinical change, you really have to sit down and review what's going on, where in terms of with the field. So that takes time to research, and then to call patients back, because during the day there's sometimes not enough time to go over everything with the patient. So the patient might call back, let's say Thursday PM or Wednesday PM, and it takes 15 minutes. So you're calling them on, Friday afternoon, Friday night. So optimally, my day should end Friday at 5, 6 o'clock, where every note is done. But I would say right now in this part of my career, maybe 50% of the time that still I'm continuing to work. And then I have Saturday, like morning, where I'm continuing to do the leftover work on Friday. So that's pretty much my week. And then obviously I have, weeks off, and I can take as many weeks that I want. So usually I take 4 weeks, 5 weeks off during the whole year.
Oh, okay. So that's a pretty big workload. How does your like profession affect other aspects of life, like stress, mental health, like family time and giving time to other things?
Yeah.
Um,
So I think yeah. So this is the part where it gets a little tricky. Not different doctors will choose the amount of time that they would prefer to work. I'm on the heavier side of things, but I would argue that most medical oncologists who are private medical oncology, meaning not in the academic setting, um, will be working maybe a little less harder like than this. It will take them a 5 full day work days to get through their work. And so but so that does make things a little bit more difficult in terms of how how much family time you have. And so what for me, almost every moment, like I don't think I have too many other hobbies now other than family, right? So that means Saturday, Sunday, and every single slip of an hour, and Fridays where it's sort of broken up, you're sort of working from home, right? So you have that. So you have to devote to your family. And I think that how it affects them, I think is probably a better question to ask them. But I can tell, I sometimes, like we call it in my house screw tightening. It's like sometimes, like screws get loose. So you got to go back, you got to work on things, like people, like if you're a little kid and your dad who might be at least somewhat of the disciplinarian, you're not there, you're going to be a little bit loose around the edges and just sort of do things. So sometimes I can see that happening. I got to tighten the screw, but there's enough time. For example, like, okay, when you come at 8, you still have that time before you go to bed, 7:30 to 8 o'clock, where you're with your kids, reviewing Quran, or where towards the on Fridays and Saturday, Sundays, you're playing basketball with them, or things like that. So there, the time outside of it, the family, I feel like does have to sacrifice. You have to have a family that realizes, okay, the nature of this field is different, and it can be almost like if you can get everybody to buy into this, that's wonderful. Like where everybody feels like, all right, what this guy's doing, like he's being the president of the United States, all right? Like Michelle Obama will tell you how rough it was when he was in the president going there. Every time I say this, my employees and my wife will be like, "You're not the president of the United States," and I understand that. But I love to have buy-in like I was the president of the United States. But but I think oncologists, or I don't know, maybe I should not speak, but I have an outsized view of the importance of my field, like where I feel like what I'm doing really matters. So I'm trying, I like to try, not, and I don't always get it, but the buy-in from the family is, look, what I'm doing is something really sacred, holy. I have to do it to the best of my abilities, to the best of any, like as the best possible. And the amount of time and dedication that's required to help these patients is a lot. Let me have it. I'll tell you that there are oncologists that treat this as a 9 to 5. There are doctors that treat this as a 9 to 5. And personally, I know I might get skewered for this, but I hate them, because I once had a patient come to me, and this patient, like, is an older patient in her 70s, healthy, but she had an issue. She came to the doctor, and she tried to call the doctor's office, or something happened. And it was after 5 o'clock, and the doctor, for some reason, her hospital had not arranged a call system where they cover the calls. So that doctor said, look, my responsibility is only from 9 to 5. I don't want anybody disturbing me after 5 o'clock. And that patient was really hurt because she was been taken care of by these family physicians that sometimes had even invited them to their house if there was a problem. Like 7 o'clock at night, you called up the doctor, and the doctor was like, hey, I've got this thing happen to me, and there's an infection here. hey, just come on down to my house. This is how it was maybe 30 years ago.
Yeah.
There was lines weren't drawn so clearly between life and work. But I'm telling you, I mean, and the rest of your viewers, that those people who treat medicine like a 9 to 5 job, they shouldn't be in medicine.
Yeah.
Because when you cut people off, this patient has a new diagnosis of breast cancer, and you have to explain to them that they have stage 4 disease. And as soon as that clock hits 5, because you got to go, do something with your family, you cut them off. You like cut them off at a place where you leave them hanging. You weren't there in the tunnel with them to get them to the light. You just
Yeah.
basically from the outside. So I think the people who go into medicine should be devoted to the holy practice that is medicine.
Yeah.
And if they go into the practice that is holy medicine, they should enjoy it. Okay. Like you really, because if you don't enjoy it, it'll be heck for you through the whole time that you're there. And number two, you have to be willing to devote sacrifice. And yes, with sacrifice comes with money to buy a house like this, or like all these other things. But you have to understand that if it was that money that got you here, most patients now, they walk into a patient's office, they can immediately recognize a doctor that's only doing it so they can pay for their car payments, house payments, and whatever it is. And it becomes cheap, and it becomes kind of not helpful at all. You can harm patients by being that way. So
Yeah.
being committed to this field and willing to like put in kinds of the time and effort to it, I think it's an important component. So that means you have to have families that understand this
Yeah.
is also a sacrifice that we're doing.
Mhm.
It's hard. Yeah. So and not everybody, no, even my own family who thinks, I hope that I'm doing something holy, but they still are not. Like they need me too. So there's a balance that you want, but the shift of the balance always to be towards working the obligation to your patients.
Yeah. Okay. That was very insightful. How I think, like, from my experience, I definitely agree with you. I also have a doctor. My basically our family doctor. She's very much like that. She's like if you call her at like 8 or 9, even like very late, she'll answer. She'll like even like FaceTime and look at my nose, try to find like the symptoms and all that. And I think that's great, and I think that's what a doctor should do. I think they should like really actually care about their patient.
Yeah. Yeah.
Um,
Yeah.
okay. Yeah.
There's a side comment here that I don't know whether you want to include it or not, but there is some people who treat medicine like a business, right?
Yeah.
Like that. And I'm we don't want to I don't want to be too harsh on them, but I'm not like that. I think
Yeah.
that I treat medicine like a profession, like that. This is what I'm here to do, not to make money off of it or not.
Yeah.
Now, the people who treat it like a business, they have a very different way of doing things. And I think their hours are better and they probably make more money, and they turn it around and they look for ways to, get retired quickly, and so they can move on to more money. They'll buy the property that they're working on, and then they'll pay themselves rent. And there's this whole system that you can make a lot of money off of becoming a physician. And I'm sure that's okay. But I think what I was trying to get at is there's a level of distraction that can occur when you do this. And I feel like medicine is one of those things that the more focused you are in it, it does require sacrifice from family, and it does require sacrifice from yourselves. And you get to be an old man when you're in my position. Like the
Yeah.
whole life has passed you by and you've done nothing. It's like outside of the field of medicine. If someone asks you to change a light bulb, inshallah, you've learned how to change a light bulb, but you're not as good as someone who's been doing other things other than changing light bulbs,
Yeah.
right? So, like, I think there is good doctors, unfortunately, have to make sacrifices and other things. But I feel like a lot of medical school admissions process are requesting that you try to be good at many things at the same time, which is good. But yeah, so we are, like, I think the group as a whole I see as a pretty talented group. They could do lots of things, but the best of them become focused on one thing, and then yeah.
Okay. A lot of high schoolers, like when they're looking at medicine, and even like college students
Mhm.
before they start their real career, they're looking into how much money am I gonna make? When am I gonna start making money?
Mhm.
am I gonna start making money when I'm 40 years old? Is that when I'll finish all my residency and fellowship and all of that
Yeah.
stuff? So
Yeah.
can you like elaborate in that area and
Yeah.
how? Yeah.
I mean, that question's an important one, I think, to that, hey, how much money does someone make? And I think so when you graduate from high school, you go to college. So you're running the negatives because you're paying for college. Okay. Then you go to medical school. Okay. You run more negative because medical school is expensive, as you may have heard. Okay. So you run negative for a solid 8 years. Okay. And then when you're actually applying for residency, which is your training program, that's residencies are usually 3 years. That's the first time you get to see a paycheck. And that paycheck is probably not much more starting out than a teacher's salary, depending on which state you live in. Maybe a little bit more than that. So I can when I was starting, I remember my starting residency I think was 40,000. It's different from state to state because cost of living is different. But so 40 to 50,000, and so now the number of years you are. So when you're your first year, they call you a PGY1. Okay. And then when you go to the second year, you go to PGY2. So every PGY year that you go up, so PGY 8 or 9 of your training, your money, your salary incrementally goes up higher, right? So at the end of I had 3 years of internal medicine and 3 years of medical oncology. So 6 years of my training of my fellowship. So 6 years total of training. So I was a PGY 6 when I graduated, but so my salary was still probably, I would say, maybe like 50 to 60, so more than a teacher by that time. And then I was but in my after I did my 3 years of um internal medicine, then you're able to do moonlighting. At the time I had like 2 kids, and so I needed to pay some, lots of bills and pay for education, all that stuff. So I actually did do not a lot, but a decent amount of moonlighting, enough to pay it. So that's where you can, some of the shifts that you work in the ER or in the hospital, you start to make some money. But then after you graduate from either internal medicine and you graduate from either fellowship, then is when your true salary starts to come in. And I think it's you can find probably salaries that range anywhere from 100 to 150,000, all the way, the number's probably infinity. Some of those business guys probably can make that kind of money. And then but it's very specialty, different. If you look at the median salary of medical oncologists in the United States, it's probably around $500,000 so per
Yeah.
year. So I think that's about what what every oncologist would expect to make after. Yeah.
Okay. Okay. And um, so you know how we're like our audience is high schoolers and college students. Is there anything you would like to tell them before they start their journey or as they're starting their journey towards becoming an oncologist or any other specialty in the medical field?
Yeah. Yeah. So I think my advice, we obviously high school students come and shadow me and college students come and shadow me. I think my advice to them is whatever you do in life, um, we should learn to do it well. And really focus on becoming good at it and maybe even the best at it. And so when you do that, you'll provide whether you're an engineer or an oil mechanic, a car mechanic. I think if you do it well, it can be a source of both personal reward and also reward in terms of like the business growing. Like if you do something well, other people will eventually recognize it and they will come to you, and you will get blessings within your work so that you can move on and grow both personally and by your in your business and your goals and all that. So really focusing on doing everything well is, I think, my advice. So that means though, as a high school student, like I remember, I still regret, like we had a French class, and for some reason I just chose to slack off. I wasn't, obviously, when you're still an A student, but you're not really learning as well you could have. And I go back and look, why didn't I learn French? Like could have been something that every word you learn sometimes helps if I end up with a French patient or going there.
Yeah.
So yeah, there's things in school and things that you're doing. You're assigned this task that you have to do it. Do it well, and if it means like parking the car before going to high school, make sure it's parked in the middle of the two lines, not crossing the line. That's so it starts from even the minutest detail of this attention to detail and doing it well. It carries on through your life, and if you make it a habit, I think that's what successful people do.
Well, it's been nice having you here on my YouTube channel. Thank you for being here.